Hello, friends. I'll be giving a overview on this topic, which seems to be trending in most meetings now about Green ICU. So this I had to deliberate in South Zone conference in Trivandrum that happened on 23rd August. So when you embark on reading about this Green ICU, many of the things that you would see appears quite archaic, but there is some sort of a philosophical outlook that you need to have in mind when we are approaching this particular topic, because most of it are the run-of-the-mill processes that are there where certain tweakings may be necessitated with a little sensitization on the concept of Green ICU. But I'll give you a little take-home message, especially for trainees, because this can definitely be asked as an exam question. At least there are certain key words or key concepts that you need to articulate to have conceptual understanding of what this Green IC is all about. There is a YouTube link I've given in the box. So there is a similar talk I've given on sustainability in ICU. So now the question is there any difference between Green ICU and sustainability in ICU? So there is an interplay between these two. Sustainability in ICU is a broader dimension which encompasses 3 to 4 pillars as to how we make the resource optimization and the operational aspects of certain units as sustainable. In that, one dimension is Green ICU. So they have an interplay. So there is a close sort of a synergy between Green ICU comes within the ambit of sustainability. So the link I've given below is the whole talk only on sustainability. So this particular talk will focus more on Green ICU with a bit of a component on sustainability. So why are we talking about Green ICU? The whole reason why every dimension, professional dimension or the career dimension anyone is speaking, Green ICU is making inroads. So this is, I would look at it more from the philosophical aspect. So philosophically, one should be sensitized into the concept of incorporating eco-friendly sort of a practices in their day-to-day life is what Green ICU is all about. So you adopt that practice within your functional ecosystem, you call it as Green ICU because of the global warming that is happening. It is the measures that one has to undertake to minimize the global warming is what is all ecosystem about. So now our focus is more on ICU. Why ICU is come into focus? Because when you look at the healthcare or the hospitals as a contributors for the carbon print, which we call it as the climate effect. We use the scientific word we tend to use in this presentation is carbon print, is around 5%. So the healthcare contributes 5% to the carbon print for the climate change that may be happening. In hospital, I think it is fairly intuitive for us to realize that ICU is a very intense environment. So obviously the carbon emissions are more. Why it is intense? Because we have more instruments, we have more gadgets, we have more sound, we have more sort of equipment usage, and we have very sick patients. All this contribute to more sort of a carbon print. So, and it is shown that ICU contributes significantly to this sort of a carbon print because of the complex nature of the whole ecosystem in ICU, and it is resource intense. Because it is resource, wherever you hyper utilizing resources, your carbon print is more. When I say hyper utilizing, where you're using energy more. If there are more equipments and if there is more intense patients, obviously you're using more instruments. It means more energy is being used. So energy becomes a very important contributor to the greenhouse effect or to the carbon print that leads on to the climate change. And Green ICU is actually an acronym. If you look, as I said, Green ICU is a part of sustainability. So the Green ICU is not going green. I know it is called going green, but it's an acronym which is called Greater Environmental Sustainability. So sustainability is embedded within the whole concept of Green ICU, or Green ICU is embedded within the sustainability. Greater environmental sustainability. And the whole concept is an evidence-based medicine approach to reducing the carbon footprint is what Green ICU is all about. So it is an evidence-based practices that we adopt, keeping a tab and keeping a sensibility on reducing the carbon emission and the carbon footprint. And In intensive care, we talk about patient-centric, right? I mean, obviously, all our care that we provide is in the patient best interest. We call it as patient-centric. And how do we offer the care? By adopting evidence-based medicine, we call it as evidence-based medicine-centric, by following best practice guidelines or following the protocols. Now, the suggestion is you have to add planet-centric. So this is the components. So patient-centric, and evidence-based centric and planet-centric is what has been suggested as a science to be adopted henceforth, that we need to have this sensibility. So the most components of my talk comes from this latest paper, because this is the position paper that came in 2024 as a ESICM position statement on green paper. So the keynotes of my presentation will revolve around the components. So for all the trainees, when this is asked in exam, so there are few things that you are meant to mention. So there are 4 P's which govern the whole science of green ICU. 4 P. P. So 4 P is very simple. So at least in exam, if they ask, write this. So green ICU, acronym, why we talk about it. 4 P's is people. 1 P stands for people. When we say people, it is patients, it is the staff, doctors and nurses, it is the families, which all form the ecosystem of ICU. And how we adopt these practices in this ecosystem is 1 P. The second P is all the consumables we use, the products, maybe using gloves. So simplistically, the utilization of consumables, because your ICU is hyper intense, is more. You're using more mask, you're using more cap, you're using more gown, you're using more scrubs. All these are contributing to your carbon footprint. That's what it means. So the type of products that we use and the amount of products we use, all this adds to the green ICU. So the whole focus should be how we can lessen the use of these products, how we use it better, and how we use eco-friendly products. So that's the whole science we need to, that is the second piece, products. So the third P is processes, functional aspects. So the whole focus is to achieve more by doing less. And I'm sure many of the intensive care friends would have heard less is more. So how we try to use less resources to maximize its utility, to maximize the outcome benefit is what we have to look at. And processes for early detection of trends, so that actions are taken early on to prevent the sentinel event. Because once the sentinel event happens, without your preventative elements, obviously resource consumption is more and it will attribute to the. So philosophically, you try to close your eyes and put this into perspective. ICU is all about this, how we take measures to prevent a sentinel event, where we very vigilantly follow through the trends, catch the trend early and prevent the decompensation of a patient. All this is a part of your green ICU effort. And obviously processes put in a protocolized way, operational efficiencies to influence better clinical outcomes. So the third P is the processes. What is the fourth P? Fourth P is planet. So how we take eco-friendly sort of a thought or ideation forward. And this is in exam, if they ask about green ICU, there are at least few words you should remember. 3 R's. So what are the 3 R's? Reduce usage, reuse, and recycle. So at least you have to somehow remember these 3 R's. Reduce the usage of consumables or resources, and as much as possible use eco-friendly, reuse, and recycle. So this is the way to go forward with eco-friendly way. So these are the 4 P's which form the pillars of green ICU. So we'll try to elaborate on those. So when you talk about green ICU, we talk about patient. So we said no, 1 P is people, patient and families and the staff. So patient, the third is education, training, and research. So these are the 3 sort of components which govern the functioning of green ICU. And the societal endeavor. How we're all part of Indian Society of Critical Care Medicine, which is a phase of ICU in India. How societally certain measures can be undertaken. So these are the governing aspects of green ICU. When we talk about people, which is patient care, doctors and staff, one important aspect in green ICU is try to see how best we can conserve water. And use water judiciously and not cause a lot of wastage of water. That is an important aspect. And try to use more renewable energy. So obviously, you all would have heard the way we can go green is less of fossil fuel, less of electricity. Try to use more of solar-based energies or wind-based energies, so on and so forth. And third is optimizing energy efficiency because many often, even in my ICU, lights are always put on and a lot of sounds. All these are contributing to the energy. So there have to be measures put in place to have energy efficiency processes also put in place. And again, reduce, recycle, reuse. Reduce, recycle, reuse. And the third aspect is try to use eco-friendly sort of a products. So these are the three important elements when it comes to patient care, certain things to be kept in mind. And optimizing the use of certain drugs and antibiotics, how we maintain the wastage component because the waste disposal, so that there is no environmental contamination for these antibiotics. All this form part of your green ICU. And most importantly, waste management. How we ensure there is no environmental contamination with the type of drugs because there is a whole list. Because green ICU, we can talk about half an hour only on how we optimize and recycle, reduce, and reuse certain products that we dispose from ICU. It may be blood products, it may be the linen, or it may be all the antibiotic vials. They all have residual antibiotics which can contaminate water, contaminate nature, contaminate soil. So measures have to be taken so that there is no remnants of it contaminating the environment. So this, although it is simplistic, very intuitive, very archaic, but efforts have to be put in place that there is a safe disposal and waste management has to happen effectively. So that is about one component. So education. So everyone working in ICU, they have coined the word green teams. So create a green team. When you say green team, provide adequate information to each and every personnel working in ICU so that they're aware of this concept of how we need to minimize the carbon footprint in the places they work and regular teaching, like how I'm doing, teaching, training, and having certain defined courses so that people go through these rigorous courses so that it is dinned into them and it becomes a matter of fact with the type of practices one adopts and collaborative sort of a work with the policy makers within the organization to implement these processes at the workplace. So this is about education and training, which govern the success of Green ICU. Research. So this is very important. Again, I want to stress. So going from paper to paperless. So we are all working currently almost in paperless where everything is electronic. So the impetus should be to go electronic. And I spoke about future of ICU, where I said tele ICU is the way to go. Then I spoke about center of excellence. To create center of excellence, I said tele ICU. Even for green ICU, tele ICU is important. Why it is important? Because when you do tele ICU or tele consult, you are preventing certain patients to unnecessarily come from one place to another, utilizing their car, emitting the exhaust, and contaminating. All this can be reduced. It's a simple step. If you are doing a digital consult or a tele ICU, unnecessary commuting for a simple reason or preventing unnecessary commute and of multiple people, all this can be mitigated. This is also a novel way of looking at how it can minimize your carbon footprint by adopting digital consultation, tele-ICU, so on and so forth. And energy conservation is an important aspect. How certain research can be put in place to effectively minimize the energy consumption. How can we do? Have sensors in place. If patient is there, light should be on. If a nurse enters, light should be on, so on and so forth. So a lot of things you can work on energy efficiency and waste management. Effective waste management forms an integral. So in exam, if they ask, if I am correcting a paper, at least I need to hear 3 R's. Reduce, reuse, recycle, energy efficiency, I need to hear waste management. If you at least these 5 components have to be there in green. You read any paper, any literature, whole things revolves around energy optimizations, energy efficiency, waste management, reduce, refill, recycle, reduce, refill, recycle, reduce, refill, recycle. If these things have to resonate as a song for anyone who talks on Green ICU. And most important, which is difficult thing, is funding. So any funding that may be needed to adopt this Green ICU has to be put in place and have a checklist and agenda how we are going to execute this Green ICU is the way to go. So these are all the drivers. So when you have to talk about drivers, these are the drivers of intensive care. And how can a society take part, like Indian Society of Critical Care Medicine, how can it take part in enforcing or adopting or assisting ICUs to adopt Green ICU? Have a clear strategy. ICCM, maybe perhaps we should come with a position statement on the checklist how ICUs can adopt the Green ICU, have certain attainable targets, and look at the cost minimization by adopting Green ICU and funding for this. And this is very important for a society for whom I am a representative member now. They've even suggested if societies are doing conference, they have to identify green venues where you look at a venue where energy efficiency is optimized through solar or renewable energy, where there is a venue where they are using eco-friendly products. So maybe I have to consider this when I'm doing next national conference and use more of digital medium rather than pamphlets, brochures, holding. So the move is more towards using digital sort of a template for navigating through the whole conference. And there is something called eco catering, green catering or eco catering, where you use disposables. So, of course, very often you would see a lot of plastic being used in the dining areas. So that should possibly be replaced with all biodegradable or eco products, and even the plates should be eco friendly, so on and so forth. There are multiple things. So you can have another 10-minute talk only on eco catering. And again, the same things I'm repeating. So water conservation, energy efficiency, waste management, how effectively as a society we can adopt this in certain practices. This is very important. Very nice, no? This picture is so nice, where all the audience coming, faculty, delegates, they should consider using public transport and the transport which runs on electricity or whichever on battery rather than the fossil fuel. So very innovative, very philosophical, very novel thought. So it's all about ideation as to how, as intensivists, we can look at using more sort of a these eco-friendly vehicles and public transport and minimize the use of personalized vehicle for commuting, so on and so forth. So all these are part of societal endeavors. So now, what are the proposed pathway for sustainable? As I said, they are interused. Sustainability is a part of Green ICU, and Green ICU is part of sustainability. What are the proposed pathways for sustainable Green ICU? So the suggestion is you should have a collaborative sort of an approach with the policymakers, and there should be interdepartmental, intra-departmental, and inter-hospital sort of a communication to adopt this and streamlining this sort of a Green ICU concept. And the process, that is the sub process, that's the support structure. The process is to create green teams. Green teams is who take on the ombudsmanship or who champion the cause of green. So there are called green leaders. Like you have an ICU director, you can have a green leader who's only focused, like you have an infection control nurse. So the green champion or whatever you want to call, their only whole focus is to go on every day trying to visiting ICU and see where all the optimization and energy efficiency can happen, where sort of a waste management is happening effectively, how water conservation can happen effectively. So they basically champion this cause. So where they look at how they can reduce the usage of resources, how effectively certain products can be recycled, and there is a constant sort of a thought process, rethinking. Another R one can adopt in greenhouse is rethinking. Some sort of a rethinking and innovative sort of a thought process has to be there. And even there is a proposal to create a green bundles, like how we have a web bundle, CRBS. Maybe going forward, we'll have green bundles where there'll be mandatory certain aspects which needs to be put in place when we talk about green ICU. And the third aspect is to look at outcomes. So these are the three components: structural process, functional process, and outcome process. So outcome, look at the targets that could be attained, continuously measure the outcomes, and there is continuous sort of adaptations, and there is a lot of knowledge activities. What we are doing currently, I'm sitting with three of my colleagues and we are doing knowledge transfer. So continuously impart the knowledge, importance, relevance, and operational efficiency of this green ICU to reduce the carbon footprint is what can be put in place. And it is also important to empower ICU staff to be climate advocates. Again, as I said, try to see how green teams can be effective in reducing the unnecessary care and low value care. And one needs to keep in mind the concept of de-escalation and sustainability. And these green teams' responsibility is to spread the awareness, spread the knowledge to all the other ancillary departments of ICU, which is pharmacy, dietitians, housekeeping, and respiratory therapists, where this concept of green ICU has to be infused and instilled into all the allied specialties related to ICU. And as I said, ICU director or ICU head has to identify the champions who are putting their effort into championing this green ICU course. And even there is a proposal that have a department of green ICU within your own ecosystem, whose whole focus is to try and audit what measures are being continuously taken to reduce the carbon footprint and reduce the wastage. And there is a whole proposal to talk about green equipments that are used in ICU, which can be biodegradable syringes and safe disposal and the eco transport, so on and so forth, eco monitors. So all this is a futuristic thought process, how everything we use in ICU become more eco-friendly and certain processes to reduce the carbon footprint. So these are some of the key things. Then there are two important things as trainees one should know when we talk about green ICU, which is called LCA and MCA, which is life cycle assessment and material cycle assessment. These are all a sort of a I would say it is more of a topics to be adopted to do research and see how effectively you have been able to reduce the carbon footprint by doing certain studies. And what is this is life cycle assessment. Basically, we start, I will show you examples, it is not theory, where we start from where things can be curtailed until the final products. If you see here, so the product starts from felling the trees to the use of machinery, to the industry, to the transport, and the waste recycle and waste management. How you can curtail at every step to reduce the carbon footprint is the way. And there are two studies. One has come from Australia, which said the 3/4 of the carbon footprint come from the energy. So, which means reckless energy usage is the one which contributes to 3/4 of the carbon footprint. So, there's another study that's come from US which suggests that 1/3 of the carbon footprint come from the energy inefficiency. So focus should be on the facility managers to see how effectively we can conserve energy. The simplistic way we can look at is using renewable energy and having sensors in every place, like bathroom light not left alone. So if you're not using any place in ICU, the cubicle, the light automatically should be put off. So only when patient is there, the light should be on, so on and so forth. So multiple things could be adopted because 3/4 of the carbon footprint comes from energy expenditure. And how is material flow takes place? Again, it is a similar concept of life cycle analysis. So material flow, it is from the beginning to the end product, how the machine sort of a flow happens. And this is important for intensivists. This is the study from Netherlands. They showed per patient in ICU, the material usage is 17 kgs per patient per day. So the whole effort is material cycle analysis means how we can curtail this sort of a resource utilization per patient. And they found 11.9 kgs come from IV fluids. So there is a plastic associated with IV fluid usage. So this is very interesting observation. So these are the studies maybe futuristically we should look at adopting the type of resource utilization that each patients undertake in ICU. And what are the other materials? You may be wondering. Very simple thing, very intuitive and archaic. These are the materials, the linen, gowns, gloves, and masks. So some sort of a judicious approach and sensibility in trying to curtail where it may not be needed, especially linen and gowns, gloves, and masks. So these are some things that one has to put in mind. And this is a topic of discussion where one can have a panel and try to debate how we can curtail the use of reusable gowns or biodegradable gowns or biodegradable gloves, biodegradable masks, so on and so forth, we can think of. So there is something called SusQI framework, which again trainees possibly should are expected to know because this is sustainability quality improvement framework. So it's not a very magic word, it's just a sustainability quality initiative framework. It's called SusQI framework, which becomes a part of Green ICU. So the goal is how we maintain good quality improvements by maximizing sustain. So which means quality is embedded into into your sustainability means. If you are not sustainable, it means your quality, one of the quality index is breached. So UI, maximizing with sustainable value, is what is SusQI framework, where with that you try to have maximal health gain with an intent that you reduce the cost, reduce the carbon footprint, and then you have a collaborative and a social value, add social value to it. So there is something called resource stewardship. Now we are talking about the antibiotic stewardship. We spoke about fluid stewardship, antifungal stewardship, sepsis stewardship. Now there's something called, if you talk about green ICU or sustainable ICU, one has to talk about resource stewardship. Resource stewardship is identifying the right patient and offering the right treatment at right time. That's all it is. So this is resource stewardship, which becomes a part of sustainable ICU and reducing the carbon footprint. So the SusQI framework works on certain principles, studying the system. I'll show you examples to try and comprehend how we apply it in practical sense. So you have to study the system. So one has to look at the input, and with that input, what is the sort of output, which we call it as a lean system. So the intent is to reduce the wastage and identify the potential assets. So the whole process of SusQI framework is to reduce the carbon footprint with innovative sort of a processes to be put in place and radically change the status quo that ICU may be following. So I'll explain this with the example. SusQI framework has actionable points. Then there is a primary driver and then there is a secondary driver. I'll show you an example how this SusQI framework. So they have done the study. They have put this SusQI framework and studied the system. It's a very beautiful slide if you remember. If you see this, maximum sort of a carbon footprint hotspots in the healthcare. This graph basically shows the carbon footprint hotspots in healthcare. Pharmaceuticals are the maximum. Second thing is medical instruments and equipments. And the third thing is all the energy expenditure and electricity. So a lot of hotspots come from pharmaceutical sort of a prescriptions and wastage and the consumables, then medical instruments and equipment and energy expenditure, along with a lot of other things as you see. Everything adds on to the carbon footprint, like use of paper, waste product recycling, so on and so forth. So this is important. The example I'm showing you for SusQI framework, how we can handle the respiratory inhaler prescribing. So it's called driver diagram. You have actionable points, primary driver and secondary driver. What are the actionable points? So as I said, life cycle analysis, material flow analysis, we have to go to the root. So the root case for inhaler prescribing is try to curb smoking and use energy efficiency in home improvement and avoid environmental pollution and avoid sort of a exposure to pollutants from vehicles. Those are actionable points. So these are the preventable steps that you don't smoke, energy efficiency, don't get exposed to smoke, don't expose to the fossil exhaust. Secondary drivers is what this will lead is reduce smoking, reduce cold exposure, reduce this. These are the secondary drivers. Ultimately, your end point is you are reducing the lung disease. This is how the SusQI framework works. So you are going to the root cause, right? You are not treating the lung problem. You are going to the preventable aspect, which is curtailing the pollution. This is what is all about Green ICU, how you go to the root cause. They're very innate, very intuitive and can apply common sense, and this is how it works. It's philosophical, that's why I said. So have a checklist. Regular health checks is another way, and rehabilitation. And there is a lean program which you can remember for all managerial people. There is something called input. You give input, you collect feedback, then you change the practice and you relearn. So this is the lean project which you have to adopt and empower people. So again, the actionable points is how by reducing paper usage, so and reviewing the whole the use of inhalers, adopting to the guidelines and recycling helps in attaining the actionable points, which is reducing the waste and optimizing the inhaler user, and primary driver is reducing the carbon footprint. So the whole outcome of all this is to improve sustainability and improve the usage of respiratory or optimizing the usage of respiratory inhaling. So that's about the inhaler. So how do we apply this SusQI format in ICU for CRBSI? CRBSI again, you go to the root cause. You take an action that try to prevent CRBSI by looking at the dressings and changing the dressings at regular intervals, having a checklist which is CRBSI bundles, and train the staff to do blood drawing and maintaining of CVC catheters, type condition, and you have to take aseptic precautions while inserting catheter and reduce repeated manipulation. So these are all the drivers. These are all the actionable points. And your primary driver is what? Reducing CRBSI. So this is how CR and constant teaching on adopting your CRBSI bundle. So this is you're all doing this, but putting it into a process way and trying to see how we prevent the sentinel thing is all about SusQI Framework, which is a sustainable quality improvement project. So again, adopting guidelines, recycling, using biodegradable. Secondary drivers is reduce CVC usage, optimal dressing, reduces the CRBSI infections, and take a feedback, change, and learn. So apply the lean project. Primary driver, as I said, is to reduce the CRBSI, which is a quality initiative product. So you got this, right? So the first one we spoke about how actionable points, secondary driver will lead to reduction in the lung disease. The second one we saw how by doing optimal dressings, care of the catheter, reduced manipulations, and reducing the CVC use, good dressing reduces the CRBSI, which is a quality initiative. And all this will reduce the burden on the healthcare. So that is the whole concept about sustainable healthcare or Green ICU. So embedding sustainability into everyday practice happens with education and training and adopting the resource stewardship. What is resource stewardship? Right patient, right clinical care at right time, which I already mentioned. And there is something called National Quality Board, whose whole purpose is shared commitment to quality by marrying or by intertwining quality into sustainability. So we were talking, all intensivists know what quality is. Now you have to marry or intertwine quality along with sustainable to make it into more robust sort of a sustainability. And adoption of SusQI is sustainable category, and one has to create certain indices where you can create champions for this sustainability. So that's about it, and conduct research. So finally, when you talk about Green ICU, from ICU standpoint, you have to adopt strict antimicrobial stewardship. Why? Because we don't want to overuse antibiotics, and safe disposal and good waste management. All this is a part of Green ICU. And put the drivers, put actionable points, secondary drivers and primary drivers to prevent CRBSI, VAP and E8U, which are all quality initiatives in a sustainable way so that it reduces the carbon footprint and makes ICU resource more sustainable. And continuous knowledge transfer, which we are doing like how we are doing. Conflict resolution also is an important aspect of Green ICU component within ICU. And how you take measures to reduce the cost in ICU also becomes a part of Green ICU. And doctors' well-being, how doctors are stress-free and feel empowered also is a part of your Green ICU concept. And how effectively we're managing end of life also is a Green ICU, so that you are reducing the resource where you know is futile and it will add to the carbon. So these are the different sort of dimensions within ICU, which you should focus on when you talk about Green ICU. Finally, friends, so there's a lot of jargon we spoke, but that's all part of Green ICU, not a jargon, sorry, but these are all the components. But you have, it is fairly intuitive, but you have to structure your intuitions to put it in a formative way to understand. So just remember the key aspect, the take-home message is this. Green ICU, the whole intent is philosophically to reduce the carbon footprint. Please remember only these three: reduce, reuse, recycle, and water conservation, energy efficiency, and waste management, effective waste management. And think of green venues, eco catering, and use public transport or green transport. and try to adopt more of eco-friendly sort of a ICU products, whichever you are using. Future is going eco-friendly monitors, eco-friendly sort of a syringes, so on and so forth. And finally, whatever you're doing at every step, think green. Then automatically things will fall in place. So that's about it, friends. So whatever you read, these are all the key ingredients of Green ICU, which is a part of sustainable ICU or sustainability in healthcare. There's a separate video on it. Again, I've spoken a lot of this same jargon. So go and visit that video and I put the link there. So that's about it, friends. So thank you all. So request you all to submit your valuable work to Journal of Acute Care. Visit my website to rehab this report. Thank you. Thank you very much.